The use of cannabis in the United States has exploded following the passage of the Farm Bill in 2018. This bill made CBD legal from coast to coast within the United States, and many states are opting to allow products that include THC to be used either medicinally or recreationally. Humans have a long history of the use of cannabis. But because it has been a Schedule I narcotic in the United States for many years, the amount of research that we have on the medicinal properties of marijuana are relatively limited. That said, we do know that people use CBD alone or in combination with THC for broad-ranging ailments, including pain disorders like arthritis or fibromyalgia. We know that CBD, because of its broad distribution of the CB2 receptor throughout our body, can help to quash inflammation in people who are suffering from Crohn's disease or irritable bowel syndrome. People who suffer from neurological or mental health disorders such as epilepsy, anxiety, multiple sclerosis, and PTSD may also gain benefit from the use of CBD or THC. This is because we have a broadly distributed receptor in our brain as well. We also see people using medical cannabis as a part of a sleep routine. And this is important because we know that getting a sleep routine right can have broad ranging benefits throughout many different systems of our body. Today, I am going to be talking all about the ins and outs of the appropriate use of medical cannabis. This is not a show about how do we get high and how do we discover if we're an indica or a sativa kind of person. This is about how do we take CBD and THC in the correct ratios while adding in other plant terpenes and terpenoids to create a medicinal benefit that can help be one of the pieces of the puzzle that helps us to achieve true health and wellness. Let's get to the show. Welcome to the Lindsay Elmore Show, a podcast that helps you find fulfillment amidst chaos. On this show, I interview thought leaders, doctors, creatives, spiritual gurus, and game changers who inspire you to pursue your dreams, overcome obstacles, and leave your mark. Dr. Leslie Apgar is a board-certified obstetrician and gynecologist who graduated from Penn State School of Medicine and completed her residency at Milton S. Hershey Medical Center at Penn State. Early on in her career, she joined a large practice in Columbia, Maryland, where she practiced until 2017. While she was there, she had a special interest in minimally invasive surgeries, and she cared for countless numbers of women during the time. While she was there, she listened to many complaints from women that traditional medicine often failed to address. In 2016, she and her best friend applied for and ultimately opened a medical cannabis dispensary in Maryland. Greenhouse Wellness was born, but it's not like an average dispensary where everything is focused on recreational use of cannabis. Instead, this medical cannabis dispensary runs like a residency program, with Dr. Apgar serving as attending physician, training the staff on how to talk to patients about their medical concerns, and helping patients to safely incorporate cannabis into their overall wellness routine. She co-authored High Heels: How Two Women Found Their Footing in the Medical Cannabis Industry, and is a contributing writer to 2 cannabis journals. Her passion is education and empowering women everywhere to take ownership of their health and adding in medical cannabis as one step in the equation. Dr. Leslie Apgar, welcome to the Lindsay Elmore Show.
Well, thanks for having me.
One of the things that I love helping people understand better is how everything in their body is completely connected. We have made such a mistake in modern medicine in trying to call things the cardiovascular system and the nervous system and the musculoskeletal system, when really it is all interrelated. And if there is a dysfunction in one place, there is a dysfunction in all of the places. I remember when I was in pharmacy school, this was a profound moment for me when I recognized, how does the Advil know where to go? How does it know that I have a joint ache, or how does it know that I have a headache? And then I was like, oh, no, it goes everywhere. It's just like shooting in the dark, trying to figure out what you are consciously wanting to have as that endpoint, but that's not the way the body works. It's all connected. And one of the things that connects us on a very profound and deep level is the endocannabinoid system. Teach us what that is, and what is the impact of the endocannabinoid system on my daily life?
Well, it's everything, Lindsay. And what a better physician I would have been all these years had I known about the endocannabinoid system. But sadly for me and for many practicing providers out in the world today, it was only discovered after I was done with my education. It was only really discovered in the early 90s, and certainly is taught in maybe 8 to 10% of medical school curricula. So we really don't even have that basic understanding, or we didn't. So when Gina and I, my best friend, opened up this dispensary, I had to take a deep dive into what in the heck is an endocannabinoid system and how is it that we all have one. So the endocannabinoid system, I like to explain to patients, is like your most primitive nervous system. And most creatures on the planet have it, from as simple organisms to sea squirts on up to vertebrates like humans. And it really controls every aspect of your body. It is a very primitive functions, the fight or flight reflex, the sleep, the drive to eat, the drive to protect you from fear. It is absolutely outstanding, and it's densely wired throughout all of our tissues. Now, everybody knows that cannabis is linked to something called THC, which is a cannabinoid that can get people high, and people probably understand that part of it. But what they don't understand is that the body is wired for all different kinds of cannabinoids and terpenes, which are part of the plant. And it gets to be a very complicated chemistry conversation because there's like 500 different compounds in this plant. So Dr. Meshulam out of Israel was the guru and the one to actually identify all of this way back when. And his question was, if cannabis is getting us high, if humans are using this medication to treat their ailments, how is that working? Because we must have receptors in our body then to receive that THC to then have the effect. And it really blows people's minds when I explain to them that we make our own cannabis in our bodies every day. We just don't call it cannabis, but anandamide, which is the first endocannabinoid that was discovered, is named after the Sanskrit word for bliss or supreme joy. And Gina and I actually took that and ran with it when we named our cannabis company for women, Blissiva. It was a nod to anandamide, which is just sort of a nod to Dr. Meshulam himself, who's a god in our world. But in any case, we make our own cannabis all the time. And a lot of disease states, there's some very impressive scholars and scientists out there. I have a science crush on one of them, Dr. Ethan Russo, who has put forth a clinical endocannabinoid deficiency as a sort of a starting point for where disease starts. And another thing I tell patients is that everybody's got vitamin D deficiency, and especially people of color. And so we tell patients to take vitamin D supplements. And everybody seems to think that that's a really good idea, and the data really supports it. It's the same with cannabis. Your body is not producing your endocannabinoids at the right level, and you have dysfunction in your body. You have a thyroid that is overactive or underactive. You've got inflammation in your gut, which leads to a whole host of problems. I tell patients that disease starts in our guts all the time. It's a whole conversation. So because our bodies are so stressed out from pandemic stress, from social stress, from work stress, from diet stress, from sugar, from all the things, our body is not able to create the normal endocannabinoids and sustain us at that level. And so therefore disease is able to manifest. And so that's what I like to educate patients about. First of all, it's not about getting people high. It's about supplementing their bodies with the right amount of cannabinoids and the right ratios to help their bodies then perform at their best. So endocannabinoid system, everywhere in your body, densely wired in your brain with something called CB1 receptors. And then CB2 receptors are more in the immune system and in your major organs. But funny enough, as women, our bodies are really, really wired for cannabis, and our reproductive system has the most amount of these receptors next to the brain. So it's been really fascinating as a women's health provider. I'm a board certified OBGYN, and obviously I have a passion for empowering women and helping women. It's been really interesting to then move into cannabis for women specifically. So there's your endocannabinoid system in a nutshell, Lindsay.